Hi everybody, Dr. Brett here. Today's topic that I get very often in the consultations that we do in the clinics, which is when is it appropriate to go for surgery? Do I need a surgical procedure? And these are the top three that I would tell you that I get as reasons to go for a surgical procedure. Number one is an emergency situation. So this is a non-negotiable one, right? So generally you won't see these in a more conservative type of clinic anyway. Which is a loss of bowel and bladder function. If this is happening, even if it's intermittent, this is a situation that needs to be taken care of right away and is likely a surgical case. Number two, a person that's been going through conservative treatment for quite some time, in a reasonable time period, I would say. I wouldn't say, they tried it for a day or a week and they didn't feel any relief, so they just decided to go for surgery. No, I'm referring to someone who's given it a real go, and with someone obviously highly qualified to take care of these cases. There are just sometimes cases where the conservative approach does not help, or not enough. More often than not, they're going to have some effect. I mean, it's 99% of the time there's some effect. But there are cases that it's just not, or it's only reduced, say 20, 30, 40%, and it's not enough to function or not enough comfort level for the patient. And in these cases, a surgical procedure may be the best course of action for this person. And number three is patience. So if a person doesn't have time or the patience to undergo something more conservative that can take sometimes upwards of 4 to 8 weeks just to get some significant relief, then maybe a surgical procedure is the best for this type of person that just needs an absolute quick relief. I will say that, of course, there's rehabilitation that goes into that on top of that. But more often than not, after surgical procedures, you may experience that relief that you're wanting. So those are the three types of people or three types of cases that I would say are appropriate for a surgical procedure. Hope this was helpful. Please subscribe, hit like, and feel free to share. Thank you.